Hello everybody, I'm going to show you the anatomy of a sheep kidney. So this is a sheep kidney, and you know the shape of the kidney is like a bean shaped. So you can see here the kidney has two poles. This is the upper pole and this is the lower pole of the kidney. Okay, and since the shape is like a bean, this part is the medial side of the kidney, that means towards the body, midline of the body, and this area is called the hilum, and hilum is the area or indentation through which the ureter, the tube that takes the urine out from the kidney, passes. Also through the hilum, the renal artery and renal vein, that means the blood vessels, pass through the hilum. So through the hilum, the ureter, this tube, and blood vessels pass. And if you see the outer surface of the kidney, around the kidney you have the superficial fascia. So this is the superficial fascia. It provides cushion, and you see some fat tissue is also attached. Okay, so this is the superficial fascia. Now the kidney is covered by the renal capsule. Renal capsule is the covering of the kidney, and you can see here this is the renal capsule. I have inserted this needle into the renal capsule. Make sense? So this is the renal capsule that covers the kidney and also protects the kidney. Okay, and the adrenal gland, which is not shown here, rests on the upper pole of the kidney. So adrenal gland sits here. Okay, so you have the adrenal gland on the upper pole of the kidney. Now I'm going to dissect the kidney and see inside the kidney. Okay, so when you use the scalpel, make sure you hold away from the sharp blade, and use these 3 fingers, hold like this. Okay, and make sure your finger is not along the direction of the scalpel, okay, or blade. Now I'm cutting through the kidney and dividing the whole kidney into front and back parts. That means this is a coronal or frontal section. Okay, now I got to see inside the kidney. Okay, you can see the outer part. This is the outer part. This is called the cortex, and this is the inner part. This is called the medulla of the kidney. Okay, so outer cortex, anterior inner part is the medulla. Okay, and in the medulla, if you look carefully, you see pyramid shaped structures. These are called the renal pyramids. Okay, So you can see the renal pyramids. Okay, and the pointed part of the pyramid, which is inwards, this is called the papilla. Okay, so this is the renal papilla. These are papilla. So this whole thing is the pyramid, and this pointed part is called the papilla. Okay, and the papilla is actually going into the minor calyx. So it is a funnel shaped space, that is the minor calyx, and then from the minor calyx the urine goes to the major calyx, and renal pelvis is this area, and then this is the renal pelvis, and then ureter. Okay, gets narrow and becomes ureter, which goes all the way down to the urinary bladder. Okay, so this one goes to the urinary bladder, transports urine from the kidney to the bladder. Okay, and the area between the pyramids are called the columns. Okay, so this is one column between two pyramids. Make sense? So renal columns. So those are few things you can see clearly here. Okay, I'm repeating again, the outer covering that I showed you, that's the renal capsule, and outer part, after you dissect, the outer part is called the cortex, inner part is the medulla. In the medulla you have the pyramids, in between the pyramids you have the columns, and the pointed end of the pyramid is the papilla, renal papilla, and then minor calyx is a funnel shaped structure that receives the urine from the papilla. So urine is secreted into the minor calyx from the papilla. Then minor calyces join to form major calyces, and then the renal pelvis, the wider part, upper above the ureter, and then it becomes the ureter, goes to the urinary bladder. Here you see the fat. Inside the kidney you have the spaces, those are called, in the medulla, those are called the renal sinuses, and the sinuses are filled with fat or adipose tissue. Okay, and the main function of the kidney is filtration. By filtering the blood, it separates the toxic elements that should be excreted out from the body, okay, through the urine. Okay, so that's all about the kidney, anatomy of the kidney that you can see in this specimen. Thank you.